Okay, we're on part two. So recap: Cade Cunningham, the NBA player, had a collapsed lung from a so-called contact play, even though I don't consider it a contact play because what you call it
Cade Cunningham just suffered a collapsed lung after this collision on Tuesday, where the Pistons called it back spasms. First of all, for Cade, he's probably Cade after the season that he and this. Now, this has a big trickle effect.
No, not that one.
Pistons
I
MVP
call it a non-contact play.
Cade
That
Cunningham was
didn't look
diagnosed
like
with a pneumothorax to discover why a small, especially near X-ray, and symptoms rare. And to open that rib cage can be missed early. Compressive force, and it's definitely
And the
possible.
hit wasn't even that
direct
hard.
contact with.
How common are collapsed lung? How common are collapsed lung in NBA? Considered rare. They're more frequently in football than NBA. Right. So I call it a non-contact injury. So, and now I just want to pull this up right quick. Gotta go to my Cleveland. Nope, that's not the one. Right. So, what is pneumothorax or collapsed lung? When the air space between your chest wall and your lung, air in the pleural space can build up and press against your lung, causing it to partially or fully collapse. There are two main types of collapsed lung: are spontaneous and traumatic. A spontaneous pneumothorax is a collapsed lung that happens without an injury. Types: primary spontaneous pneumothorax, when no underlying health condition or disease causes the collapsed lung. This can happen if abnormal air pockets in your lung blebs break apart and release air. Secondary spontaneous pneumothorax. Certain lung diseases can lead to a collapsed lung. This can happen when your lung is blocked, causing bulging areas, bullae that can burst. And then the second one, traumatic pneumothorax. Injuries and medical procedures can cause a traumatic pneumothorax. Types include injury-related pneumothorax, when injury to your chest, like a fractured rib or knife wound, punctures your lung. Latrogenic pneumothorax. When your lung is punctured during a medical procedure like a lung biopsy or a central venous line insertion. Other types of pneumothorax. Tension pneumothorax, when air can get into your lungs but can't get out. The one-way valve effect causes pressure to build up inside of your chest. This is a serious form of pneumothorax that's a medical emergency. Catamenial pneumothorax, a rare condition that can affect people with endometriosis. Endometrial tissue growing outside of your uterus can form cysts that could bleed into your pleural space, causing your lung to collapse. So remember, Cade Cunningham's pneumothorax or collapsed lung was classified as a mild collapsed lung injury. So it would not be what we learned, a traumatic pneumothorax. Because he didn't get stabbed or break a rib. All he did was get a little baby tap by the knee on his
cage. This is a focused compressive
chest,
force, and
which we all have had as a kid. I collided. You know how many times I collided and never had a collapsed lung? It's just it wasn't that bad. So, his injury was most likely a primary spontaneous pneumothorax collapsed lung, where basically he has no conditions or diseases that he knows of, and it happened because There are abnormal air pockets in your lung. Blebs break apart and release air. And that's what we learned from the doctor, right? Let's get back to it.
This was like an iatric back. I've had multiple collapsed lungs. Powders, you get that gritty taste that doesn't dissolve very well. I didn't like messing with shaker cups, and I'd often just stagger in the car and just lining around the lung, and then there's a lining around the inside of the chest wall. That's called respiration, and oxygen pushes the lung down, leading to a collapsed lung. So collapsed lung is actually the collapsed lung. But of course, when we see an x-ray, the lung is all shriveled up and looks collapsed, and so we call it a collapsed lung. It's kind of the common way to describe what's going on. There are multiple ways you can get a collapsed lung. Most common is going to be just a spontaneous pneumothorax. That's what happened to me. It spontaneously occurs. There's no...
Right, what we just learned, right? We just learned that, right? So...
trauma, there's no iatrogenic, meaning external thing done to introduce air into the space. It just happens. What causes a spontaneous pneumothorax is you get these little blebs, these little like air pockets that can form on the surface of the lung, and those blebs can pop. And when those blebs pop, air from inside the lung gets into that pleural space, causes the pressure to go up, pushes the lung down. The other way that it can happen is from something like a trauma, like a rib injury. Any sort of trauma external can push through, can cause disruption.
Right, and it's rare. Remember, it's rare. The second part he's talking about, the trauma, is rare. It's because remember we just learned collapsed lungs are considered rare in the NBA. While they are not unheard of, they are far less frequently in the NBA than high contact leagues like the NFL. They are rare injuries, but several high profile cases have occurred in recent years. Like Cade Cunningham, right? He's going to miss at least 2 weeks. TJ McCollum, he ended up getting one and then getting it again. And that's where I was going to tell you that they can come back, but it's still rare because when there's always a root problem to these types of things, and for this problem, the root problem is the parasite. So, but let's get back to the clip. So remember what he said. The first part was primary spontaneous pneumothorax, when there is no underlying health condition or disease causes the collapsed lung. This can happen if an abnormal air pockets in your lung blebs break apart and release air.
Go up, and when those blebs pop, air from inside the lung gets into that pleural space, causes the pressure to go up, pushes the lung
right
down.
But what he said was those blebs he's talking about, they are already there before the collapsed lung happened. So before he got hit, he had those. He most likely had those blebs, and the dude gave him a little baby tap, and it popped it, and then boom, that's where the collapsed lung happened. He didn't just get boomed like what he's talking about. The not secondary, but the traumatic one. He got a little baby tap, popped him, and then boom. That's what I believe would happen. This was nothing, man. And then, yeah, go ahead.
Yeah. The other way that it can happen is from something, and that can be a reason for air to go from the lung into the pleural space, making the pressure go up, causing the lung to get compressed or needling and injection, dry needling for like.
So remember, football players, they deal with this shit all the time.
Story, Tyrod Taylor. A needle.
They hit each other all the time. However, this is still less frequent in football. So, because it's a rare occurrence.
For something like who can disrupt legs, working on eating he's the side of his body. This pneumothorax is on the left side. It's reported sooner than this morning. They might have found it yesterday, and we just got the reporting today. This game was Tuesday. It's now Thursday morning. If this was like a severe collapsed lung where he was short of breath, he was having a hard time breathing, etc., like emergency put in a chest tube, probably would have found it sooner than this morning, or at least reported sooner than this morning. They might have found it yesterday, and we just got the reporting today. But that would have been like a in the ER that same night sort of situation. So hopefully that means this is a smaller percentage of the lung that's collapsed. When we grade and talk about severity of these injuries, we will use it as a percentage of the lung that's collapsed. So 10% of the lung looks like it's down, 20%, etc. The bigger the percentage, the more air that's in that pleural space, the more likely to need something like a surgery, a chest tube, or a little drain put in to allow the air to escape, remove that positive pressure, let the lung reinflate. As the lung reinflates, those areas where the air was getting through can heal up, and then hopefully this is a thing of the past. So with Cunningham, the return time really depends on what they have to do. If this was something that was a very small apical pneumothorax where there's nothing introduced into the skin, there's no drain, there's no chest tube, no surgery, on average, yes, this is something that he could come back within a few weeks, 4 weeks, etc., somewhere in that time frame. You're not traveling by air, though, for a while, and so for a lengthy bit of time, even after he's back, he'll probably be taking a bus only and not up in the air because of how pressure changes when you're up in the airplane that can potentially worsen the lung problem.
Right, but at the same time, he didn't get that traumatic pneumothorax, right? So he's trying to say it could be a tension. However, he would have already been almost dead. So, that's why I don't believe it's that type of pneumothorax. So, but let's get to the other part. So we already learned about parasites can hide in tissue in the body. Yes, many parasites can hide and live within body tissues for extended periods of time, often causing chronic infections or immune reactions. They can inhabit muscles, the liver, lungs, brain, skin, and lymphatic vessels. These parasites sometimes form cysts to survive for years. Create cysts in the brain, eyes, and muscles. Right? Hookworms, right? They all release eggs, but I'm just saying, these things can hide within the body, and it probably hid through his lung and created the plebs. The blebs he was referring to, right? And we're going to get back to that part.
Going up into the oxygen exchange. With a pneumothorax, air abnormally an injection and can form on the surface of the lung happens. What causes a spontaneous pneumothorax is you get these little blebs, these little air pockets that can form on the surface of the lung.
Right. So blebs, right? So let's go back to this part. Collapsed lung caused by parasite. The collapsed lung or severe breathing issues can be caused by parasites, notably Paragonimiasis lung flukes, which acquired by eating raw, undercooked crab or crayfish, right? So, now, let's see, can Paragonimiasis cause Bleb? Yes, pulmonary Paragonimiasis can cause or radiologically mimic pulmonary Blebs and Bolay, often leading to misdiagnosis, tuberculosis, or lung cancer. The infection caused by Paragonimiasis flukes often lead to formation of fibrous cysts and tunnels in the lungs that can appear as small cyst cavities or bubble-like lesions on image. Right? So, and Paragonimiasis causes a collapsed lung primarily when migrating juvenile lung flukes damage the visceral pleural lung lining, allowing air into the pleural space. So, yeah. And then, we could do this one right quick. Excuse me. Yes, hookworm and Ascaris infections can cause serious intestinal and skin abnormalities. But let's put in lung. Yes, Ascaris can cause structural lung damage, including the formation of blebs. Remember, can blebs on the lung be asymptomatic? Yes, lung blebs, small air-filled blisters, are frequently asymptomatic and often go unnoticed until detected on imaging or until they rupture. they typically cause no symptoms unless they burst, which causes a spontaneous pneumothorax collapse lung, right? Which what Cade Cunningham had, right? That's what I believe he had. So remember, these blebs he was referring to, which the doctor ain't gonna tell you because the doctor don't know, these blebs that were there were already caused by this parasite or one of these parasites. You know. And the reason I'm saying that because the collapse lung is rare. So there's no way he got that from that little baby kick that Trey Johnson did on him. So yeah. Remember, he went to the beach. These parasites are usually found in crawfish and crayfish. He did go to the beach recently, like a year ago. Remember, this stuff can build up in your body. He has a dog. Remember, the Most High said, do not have dogs, cats. Don't touch anything with a paw. He's touching the cat. Give him the cat parasite. So I think it's the pulmonary diaphoresis that's caused by a dog heartworm. And we see him with the dog. So yeah, man, this was caused by parasites, bro. And the reason I'm doing this is because today a lot of basketball players are losing their careers because their careers are ending short because they getting sick and getting hurt, and they're getting hurt easily. And a lot of this is because they, not necessarily don't take care of their body, because they do eat a lot of healthy foods and have all the, treatments and all that. But the problem is they don't, they're not being told to get these parasites out of their body. And that's what Cade Cunningham has. So remember, NBA player CJ McCollum, he had 2 of them. He had one in 2021, then it came back 2023. And CJ McCollum eats a very healthy diet. However, the Most High said that the ground is cursed by demons, which are the parasites who work for the serpent, and they're gonna be in your food, dead animal food, etc. And you're gonna have to take wormwood, right? Wormwood and other parasitic herbs to get that stuff out your body. In the Bible, worm was a bitter plant and a star of revelation, representing divine judgment, calamity, and spiritual bitterness. Right? God, Jeremiah 9:15 and 23:15, God threatens to feed the disobedient people wormwood. Right? So you gotta take it. Right? Get these parasites out. They kill it. Now let's type we'll type it right quick. Herbs that kill Paragonimiasis. We'll do this one. So while some herbs show anti-parasitic potential in general, there is no robust scientific evidence or professional veterinary recommendation for using specific herbs to kill a Paragonimiasis killicoti infection. So now for some reason there it is. For treating Paragonimiasis killicoti infection in humans and animals, standard medical protocols recommend specific medications. These are proven effective treatments. Paraquintal is the primary drug choice for treating Paragonimiasis. Is highly effective at eliminating flukes. Fenbendazole is an effective alternate therapy, particularly in veterinary medicine, so for animals. Risk of herbal alternatives. Many herbs with general anti-parasitic properties such as wormwood, black walnut, oregano have been studied in vitro lab setting, basically a petri dish, and they're using essential oils with no dilution to destroy them. For gastrointestinal nematoids, not complex tissue dwelling flukes like the Paragonimiasis calicati, Latin word, right? So yeah, right. So gotta get on that wormwood, man. You know, or since you're an NBA player, you can go get this drug. Go ahead and knock this parasite out, and you won't, you know, you ain't gotta deal with this no more. So Cade Cunningham, if you're watching this, go get this. I would request this drug and take it. Get this shit out of you. All right, you're an NBA player. This shit should never happen again. Go get this fucking drug, or you do the wormwood right and get this shit out of you. Us regular people, we can't get this shit. We have to go through this wormwood and all that. You can get that. Now we're gonna do the other one. Herbs that kill hookworm, because it could be that too. So black walnut, cloves, garlic, these kill hookworms, right? So now we're gonna get to the scientific research, because a lot of y'all are like, what evidence do you have that the parasite causes the? Well, I do got some scientific evidence. Here we go. A case of spontaneous pneumothorax due to Paragonimiasis, North America Literature Review. Now, I remember last video, I said I was going to do this part 2. Sorry, guys, I have to explain some other information. So in part 3, we're going to talk about this research. This should be it.